My name is Corde, and my group members are Emma and Markenzie. And our topic is: do athletes recover from illness and injury quicker than non athletes? And if so, how is that possible? We wanted to research this topic to find out how the recovery process is affected by being an athlete. If there is information for this to be true, maybe it will make some people want to live a more active lifestyle. The reason we chose this topic is because all three of us have been around athletics for a long time, and both Emma and Markenzie have been through an injury recovery process.
The background information about athlete recovery process. The recovery process for an athlete depends on what injury or illness they have, whether it is from sports related injury or illness through natural cause. Some injuries, if they are mild, can simply be put through the ICE process to recover. The abbreviation for ICE, the R means rest, the I means ice, the C means compression, and the E means elevation. The Rice method is mainly used for muscle injuries. If an injury is severe, then it will need immediate medical attention. After you have been to the hospital or medical clinic, depending on how severe, you might need physical therapy to aid in the healing of your injury. An example of a severe injury would be broken bones or tearing of muscle or ligament. If an athlete comes across an illness, the recovery process will also be different depending on how severe the illness is. If an athlete has a simple common cold, he or she might just need a few medications, possibly prescribed, to get over it. If the athlete has a severe illness such as COVID 19, he or she will need to either quarantine for the directed amount of days or seek immediate medical attention depending on the symptoms.
So, our group had some bias towards this, and all three of us agree that athletes do tend to recover from injuries quicker than most people. However, none of us have ever thought about how quick athletes recover from an illness. We believe that in both cases, athletes would recover faster. There was personal bias of this topic because when I was in physical therapy for a shoulder injury, my therapist kept telling me that I was going to make a quicker recovery than most because of my age and because of me being an athlete. Hearing this from people who worked with people of all ages and both athletes and non athletes always made me think that it was a true statement. In Markenzie's case, he had a high ankle sprain playing football. When he was recovering, he was told that he would recover pretty quickly due to his athleticism. However, his recovery took longer than expected. Some of the arguments for our topic. So, according to Mark Mendezoon, it is said that athletes are much more in tune with their bodies and how they function in their sport, so they are able to notice when something is wrong sooner than the average person, and they will seek to help fix it. Even though athletes have a higher window for catching an illness, they have a better likelihood of fighting it off quicker. This is due to the fact that the immune system works better at fighting off an illness when the body has a balanced diet, which most college level and elite athletes do. Currently, during the COVID 19 pandemic, it is being researched that some athletes have a better chance at recovery if they maintain a daily routine of exercise, even if they are in isolation. This is because it is necessary to boost your immune system when in a period of limited movement in order to help prevent catching any illness, especially COVID. Athletes seem to heal faster because of modalities such as ultrasound, electric stimulation, deep tissue massage, cupping, dry needling, and stretching. Athletes typically use these on a daily basis, which also helps prevent future injury.
Arguments against. While it is shown that athletes tend to recover from an illness quickly, they are also more susceptible to catching an illness after intense training. There is an open window theory that states that after intense exercise, a person's capacity to defend against pathogens is altered, which can lead to upper respiratory symptoms for up to 72 hours after that intense exercise. Athletes are more susceptible to illness because they are in constant high stress environments. But this also differs from person to person on if they consider what they are doing to be high stress or not. For a non-athlete, an injury and recovery might not affect them as much as it would for an athlete. The athletes who strongly identify with the role of an athlete are at greater risk for adjustment struggles following a sport injury. When an athlete gets an injury, it can often facilitate a sense of loss, negative emotions, mood disturbance, and even put fear in the athlete. For some athletes, an injury can also take away compensation and even consequently increase life stress and also decrease overall well being.
After researching about our topic, our opinions have slightly changed. We realize that it is easy for it to seem like athletes heal faster. However, people's bodies heal at different rates, no matter if they're an athlete or not. Athletes have many more opportunities to get better health care right as the injury or illness occurs. Elite athletes have the ability to take the needed time to rest in order to recover at an ideal time. And athletes have the exercise and appetite to help increase their immune support. Our research has made us realize that elite athletes have more resources than the average person. Typically, non athletes will try and wait until an injury heals on its own before going to the doctor for it, or they cannot take the time out of their schedule to fully rest and recover from the injury or even illnesses. Another reason being is that the constant training and stretching helps to strengthen their muscles, which help and prevent future injuries. Our group's personal bias to this topic caused us to realize how us being on athletic teams actually help to aid in our recoveries due to our teams having extra resources available to their athletes. And these are the resources used to prepare this um, presentation.